This video provides an overview of blood pressure, covering its definition, measurement, regulation mechanisms, and clinical ranges. Blood pressure is the pressure within the body's major arterial system, measured in millimeters of mercury. It is divided into systolic pressure, which is the maximum pressure during ventricular contraction, and diastolic pressure, the minimum pressure recorded just before the next contraction. Traditionally, blood pressure is measured via auscultation, using a mercury tube sphygmomanometer. It is recorded as systolic over diastolic pressure. As a commonly measured clinical parameter, these values are vital for determining appropriate therapeutic decisions. Arterial pressure directly corresponds to cardiac output, arterial elasticity, and peripheral vascular resistance. Blood pressure is highly dynamic and can be easily altered by various activities. This diagram illustrates the various physiological components that influence arterial pressure, including factors affecting cardiac output and peripheral resistance. Maintaining blood pressure within normal limits is essential. Readings are classified into categories ranging from normal to stage 1 and stage 2 hypertension, hypertensive urgency, and emergency. Hypotension is defined as a blood pressure less than 90/60 millimeters of mercury. It is crucial for the body to adapt to acute blood pressure changes, and for patients to manage chronic variations through lifestyle adjustments or medical treatment. This chart summarizes blood pressure classifications based on systolic and diastolic ranges, from normal levels up to critical values. The baroreceptor reflex is a primary mechanism for responding to acute blood pressure changes. Baroreceptors are mechanoreceptors that detect vessel stretching and relay this information to the central nervous system to regulate cardiac output and peripheral resistance. There are two types of baroreceptors. High-pressure baroreceptors include carotid receptors, which signal via the glossopharyngeal nerve, and aortic arch receptors, which signal via the vagus nerve. There are also low-pressure baroreceptors. Antidiuretic hormone, or ADH, is synthesized in the hypothalamus. Its release is triggered by high serum osmolarity, low blood volume, decreased blood pressure, and the presence of angiotensin II. ADH functions primarily to increase free water reabsorption in the kidney's nephrons, which boosts plasma volume and arterial pressure. At higher concentrations, it also causes vasoconstriction to further increase peripheral resistance. The Renin-Angiotensin-Aldosterone System, or RAAS, regulates blood volume and vascular resistance over the long term. It utilizes renin, angiotensin II, and aldosterone to elevate arterial pressure when renal blood pressure or salt delivery decreases. This flowchart details the RAAS process, showing how renal perfusion changes trigger a cascade that results in water and salt retention to restore arterial pressure. While the RAAS is vital, inappropriate activation can lead to hypertension. For example, renal artery stenosis can cause the body to falsely sense low blood volume, resulting in an improper, sustained increase in blood pressure. Hypertension is a common chronic condition characterized by persistent elevation in arterial pressure. It is a major risk factor for heart disease, stroke, and other complications like kidney or visual impairment. Most cases are idiopathic, often referred to as essential hypertension. High blood pressure signifies that the heart and blood vessels are being overworked. If left untreated, this condition can lead to serious health issues, including atherosclerosis and congestive heart failure. Increased salt intake is linked to hypertension risk, with many patients being salt sensitive. Globally, over 1 billion adults have hypertension. The prevalence is consistent across various socioeconomic groups and rises significantly with age, affecting many individuals over 60. Controlling high blood pressure involves behavioral modifications, such as adopting a healthy, low-salt diet, regular physical activity, and stopping smoking. In some cases, medical professionals may prescribe medication or consider surgical treatments like renal denervation or neurostimulation. Hypotension is a decrease in systemic blood pressure below typical values. While often asymptomatic and considered benign, it becomes a clinical concern when pressure is insufficient to properly perfuse key organs with oxygenated blood. Monitoring blood pressure is important because elevated levels increase the long-term risk of health problems. Persistent high pressure puts extra strain on the heart and arteries, which can eventually lead to arterial thickening, loss of flexibility, or structural weakness. Regularly monitoring blood pressure is essential to manage this potential silent killer. Effective management includes long-term lifestyle changes and, when necessary, pharmacological therapy to prevent complications like heart disease, stroke, and kidney damage. Clinical studies have also suggested that certain manual therapies may assist in reducing pressure.